So why does the Stem Cell Healing Institute use platelet lysate instead of PRP? We've had that question very often. PRP meaning platelet-rich plasma, which is very often the case with most clinics. Platelet lysate is much more advanced. It's a much more refined version of PRP, so to speak. So we do get growth factors from the platelets, but what happens is they're actually isolated and purified and concentrated in such a way that once they're injected into the body, we're injecting in the pure growth factors, not the platelets. So it's much less inflammatory, much less number of treatments required versus PRP, a fraction. And recovery is much quicker and much steeper. So platelet lysate we use very often as a standalone treatment for joints, for skin, for hair loss, various different conditions. However, very often we'll combine it with the stem cell treatment. In fact, always. The only reason we keep platelet lysate as a standalone treatment is when patients don't really need the full extent of the stem cell treatment, which is quite extensive. And so when a patient's injury isn't as severe or extreme, or what we're trying to accomplish isn't something that we're looking to obtain from the high capacity and the high caliber of stem cells, that's when we'll use platelet lysate. So that's the main difference between platelet lysate and platelet-rich plasma, and when we would use platelet lysate versus stem cells, which is really an important question which most patients ask, and I'm happy to answer.